Hi, this is Nicole Watkins with Morgan James Publishing, and I'm here today with Dr. Jennifer Stebbing, author of I Can Sit Again, Non-Surgical Treatment for Tailbone Pain. Dr. Jen, thank you so much for being here with me today. It's such a pleasure to meet with you and talk about your recent release.
Thank you so much, Nicole. It's really a pleasure to have this opportunity to talk to you and to the publishing company, Morgan James. I'm really pleased that this could happen virtually in this situation.
Absolutely. Got to keep things moving forward. And speaking of which, I'd love to dive into just learning a little bit more about the book. So my first question for you, Dr. Jen, is what is the purpose of your book?
So this book is called I Can Sit Again, and it's non-surgical solutions for tailbone pain. And the purpose of this book was really as a handout for my patients. I spend a lot of time talking to my patients about non-surgical options for tailbone pain or other pain. What I found is that I was reiterating myself a lot, and many times the patients couldn't remember everything that I had told them.
Sure.
So it was really awesome to be able to hand them a book, and they see it as a gift. They can refer to it, and then they ask me really intelligent questions afterwards. So it's been a way to initiate a dialogue with them about the different treatment options I have, what to expect after they get treated, what to expect while being treated. And when there is a variation that they're concerned about, they can bring it up because they know that it's comfortable place to be to have that conversation with me. So, and it's really served its purpose in that way. And then I've gotten some emails from other people in other parts of the country and other parts of the world that have asked for solutions for their tailbone pain. And this book, although it's written very specifically for someone with tailbone pain, the principles to it and the treatment options can be applied to pain in a lot of different areas. So it starts to introduce people to ways that they can have their pain addressed. That's not necessarily covered by the typical medical system that I was trained in. And so as a family doctor, I was kind of disappointed in some of the treatment options that were available. And the fact that many patients weren't getting better when I sent them to specialists in the past. So I've been looking for good treatment options for patients for a long time now.
I think that's so important, especially in today's time. Just to have these alternative ways of treating any kind of pain that someone is experiencing. And I think you really touched on the next question I have for you is, who is this book written for?
Yeah, I originally wrote this for a patient of mine who also was a friend and also a ski buddy. And as you know, if you're familiar with skiing, many times when we ski, we sometimes fall and we fall down and we hit our tailbone and it hurts for months and weeks. And this happened to her, and I was unaware that she had so much discomfort and pain as a consequence. And then she couldn't ski the next ski season. And at that point in time, I kind of asked her the question of why. She had received chiropractic treatment. She had done a lot of work with her nutrition, and the allopathic, or the normal way of doing medicine, is offering her meds, and none of that really treated her pain. So I was really sad that I had missed the opportunity to treat her initially. And then once I started to treat her, she was able to ski the next season, which is awesome. She just, because she's so personal to me, she means so much to me. I feel really privileged to be able to help her in that form and get her back to doing something that she loved. And so that kind of framed the book, because I wrote the book for her.
That's so humbling, and just a lot of warmth coming from that, just to have that actual personal touch with someone that means so much to you, even outside of just, your normal patients. And I definitely could, relate to having pain that just prevents you from doing the things that you really want to do.
Yeah.
Skiing, I have tried that. It's definitely not my forte, but I can definitely relate to the falling down part. So I'm very happy to hear that she was able to return to something that brings her joy. And I think that probably leads us into the next question as well, is, why is this so relevant in today's time?
I think it's really, really relevant because there are people who have pain from, for example, car accidents, or people who have a wider range of motion. We call them hypermobile patients, or people who've been diagnosed with something like um, fibromyalgia. From there are ways to lump people into pain pathways where there's no end in sight. And so many of these patients, they are put on medications to control their pain, and that they're basically being band-aided the whole time. And most people want to get back to their lives. They want to work again. They want to feel productive. They want to feel useful. They want to have great relationships with their loved ones. In my friend's case, she wanted to be able to ski again with her kids. And she wanted to be able to, just sit comfortably driving to and from work, and also while she was at work. So the non-surgical treatments that are out there are not discussed and not taught in medical school, but they're having more of a worldwide exposure. And so the treatment options are called prolotherapy, platelet-rich plasma, and different types of stem cells. But really understanding what you mean when you say those terms, and when you get treated with these, what should happen in terms of diagnosing, making the diagnosis of what should be treated and how the treatments should be done. So the purpose of this book is to really walk someone through an experience with somebody who's been trained to do this. There are a lot of people who say they do something, but they don't have the medical training. And what it does is it creates a lot of confusion out there. And as you probably recognize, in this whole worldwide pandemic, is everybody is an expert and everybody has an opinion, but they don't always agree, and that makes it really confusing. So what I wanted to do was create a book where I could walk somebody through that process of asking questions and knowing what to expect with the procedure and what should be done, so that anybody who picks up the book, whether it's for tailbone pain or for mild arthritis or for car accidents, they have an idea of what questions they should be asking and how the procedures should be done.
Yes, I
Yeah.
think that's so important in today's time, and I think you're right. It's, some of the research that I've done on my own, just with chronic pain and things like that. I think you hit the nail on the head. There's so much, and I've experienced it myself, and I'm sure a lot of our viewers have too. It's that Band-Aid. We just stick a Band-Aid on the symptoms. We over medicate, but it's not really getting to the core issue and really helping to heal it, long term, to get back to our lives, as you kind of put it. And, I really think there's going to be a lot of people that resonate with this. But what I was going to say, just in my own research, I've seen a lot more information on non-surgical options. And I think that's something that just over time has been one of those things in my own finding, but I'm sure others that are either aware of it or may not be aware of it, that there are other options to just going straight to surgery, or the alternative, that just getting medication to basically Band-Aid the issue rather than actually fixing it.
Right.
So it makes me excited to see some of these other options.
Yeah. And, I'm not the only one that's doing it. This is my voice. And what it does is it allows people to understand that there's, to look for other people and to be aware that, that you don't have to live in chronic pain, and that we can use our own body's way of healing to augment our own healing. So our bodies are meant to heal. That, you know, the osteopathic premise is that if we give the body the right impulse or the right tools, it will heal. It wants to heal. And so I think that with people who are in chronic pain, that sometimes they don't even know what their options are. And it's so hard just to live day to day that they can't even make good decisions along the way. And they're not being told that there are other ways to look at it. So I feel like this is just a way, another way to get the information out there. And the more people that talk about it, the more this becomes available for a wider and wider audience.
Absolutely.
And, yeah.
And that kind of brings me to my last question for you today, Dr. Jen. I know those that are watching today are going to have more questions that were not covered in today's discussion. So where is the best place that they can connect further with you?
Yeah, I can be reached through my website. It's drstebbing.com, DR, S as in Sam, T as in table, E as in elephant, B as in boy, B as in boy, ING.com. And there's a way to email me right from the website as well. If you are a physical therapist and want to know a little bit more about this therapy, I just finished my second book, and it's called Rehabbing the Last 10%. And we're talking about options for treatment for patients who have plateaued or not progressed through physical therapy. And so that's my next book. It's more written for somebody who is more educated and understands some of the terminology, because this first book is really for people, the general public.
Right, right.
Yeah.
Oh, I love that. Thank you so much, Jen, Dr. Jen. It's been such a pleasure getting to hear more about your recent release and some of your background and how you're helping to change just the dialogue that we see out there, and letting those that are watching and those that will discover you know that there are other options rather than just surgery, rather than just a Band-Aid effect. So very grateful for the information that you've shared with us today. I do want to remind our viewers watching today that Dr. Jen's book is available wherever books are sold. So definitely check her out through her website and grab a copy of her book.
Yes, thank you so much, Nicole. This was a pleasure. I really was looking forward to talking and meeting you, and having the ability to have a platform to change people's lives and make a difference in their lives has been wonderful.
It's
so
been
really
a pleasure.
Yeah.
It's been a pleasure. Absolutely. Thank you again, Dr. Jen.